A 2015 study of drivers in Sweden found that those with sleep apnea were 2.5 times more likely to have an accident. People with sleep apnea are more likely to skip work and be fired more often. However, according to a report commissioned by the American Academy of Sleep Medicine, people tend not to associate sleep apnea with such serious health consequences. The Academy estimates that 12% of Americans suffer from sleep apnea, but 80% of them are undiagnosed with the syndrome. Approximately the same percentage can be attributed to the whole world. In the end, it will turn out that about 1 billion people on the planet suffer from moderate to severe sleep apnea, according to a 2019 study, without realizing it and without receiving the necessary treatment. More than 50% of men and 25% of women over 40 suffer from snoring. 80% of heart attacks, strokes, and sudden death during sleep occur against obstructive sleep apnea syndrome associated with snoring. People suffering from sleep apnea who have realized its danger and the need for treatment can tell a lot of interesting things about their difficult path. When sleep apnea was first discovered, the only option available to patients was a tracheostomy, an opening created at the front of the neck so a tube can be inserted into the windpipe. This brought relief, but it also had serious consequences. Diagnosed with sleep apnea in 2008, Angela Kuckler of Hot Springs, Arkansas, said she always snored loudly in her sleep, often waking up in the middle of the night gasping for breath. In 2012, she was taken to the hospital with a heart attack, and the next morning the doctor said, "We'll give you a tracheostomy." It's hard for Angela to live with a tube in her throat. It requires regular cleaning. It's like extra work. It is unpleasant. You're not breathing like a normal person. Your throat is constantly dry. You need to keep it moist. You are at risk of various infections, the woman shares. The biggest drawback for Angela is that she can no longer do her favorite swimming, and she hates being gazed at wistfully. However, her apnea was gone. "I don't snore. I can now breathe normally in my sleep. I sleep better," she said. Would she agree to such an operation again? Yes, definitely. After all, it saved her life. Michael, an Illinois resident, realized he was in serious trouble when he felt like he was literally dying. During the day, he felt so tired that his knees shook. When he was driving, he sometimes caught himself falling asleep. Exhaustion was written all over his face. At night, he slept in fits and starts, finding it difficult to find a comfortable position, often waking up with a strong beating heart, out of breath. His doctor was puzzled. He asked for tests and sent Michael for an electrocardiogram. Perhaps, he suggested, it was a heart condition, since he had such a rapid heart rate at night. But his heart was fine. The man was then sent for a colonoscopy, but the gastroenterologist did not find anything wrong with him. However, he noticed something. "When you were under anesthesia," he said, "at some point you stopped breathing for a while. You need to check. Maybe it's apnea." Apnea? Michael had never heard of such a thing. The man began to collect information, consulted a doctor, and realized that this invisible but dangerous syndrome had something to do with him. He did not even suspect that snoring was not as harmless as he used to think. The trouble is that the syndrome does not manifest itself until the person falls asleep. The only way to diagnose it is with sleep monitoring. So, in early 2009, on the advice of his doctor, Michael went to the sleep medicine laboratory in Northbrook, Illinois. Sleep medicine specialist Dr. Shives examined his throat and advised him to undergo a polysomnography, a test that monitors breathing, blood oxygen levels, heart rate, muscle, and brain activity. Michael came to the laboratory at 9 in the evening. The laboratory assistant walked him to a small room with a bed. The equipment was located in another room, the window to which was behind the headboard. The man changed his clothes, and the laboratory assistant attached electrodes to his chest and head. At about 10 p.m., he turned off the light and fell asleep pretty quickly. At 5:30 in the morning, Michael woke up and wanted to try to sleep again, but he was told that he had slept for 6 hours and the data was enough. According to Dr. Shives, he has a severe form of sleep apnea that wants his breathing stopped as much as 112 seconds, almost 2 minutes. The normal level of blood saturation is from 95% to 100%. In patients with acute chronic pulmonary insufficiency, it is usually above 80%. Michael had 69% during apnea. Something had to be done urgently. Michael didn't have many options. According to Dr. Shives, he could have undergone uvulopalatopharyngoplasty, which was even more terrifying than the name, surgery to open the upper airways by taking out the uvula, palate, and pharynx to widen the airways. The second option was a CPAP mask. Of course, Michael chose this option. In 1981, Australian Dr. Colin Sullivan have devised an innovative way to treat obstructive sleep apnea with continuous positive upper airway pressure. This method, as well as the device, is called CPAP, continuous positive airway pressure. The CPAP machine is a portable computerized compressor with a system of flexible hose and a special mask. Thanks to the operation of this unique device, a constant positive air pressure is created in the airways, which completely eliminates vibration and collapse of the pharyngeal walls during sleep. This was a revolutionary invention, since before that a person with sleep apnea could only be helped by a tracheostomy, or the very terrible uvulopalatopharyngoplasty, which was a dangerous and complicated matter. With the advent of CPAP therapy, the risks of infection in the respiratory tract disappeared because tracheostomy often led to various complications. The first CPAP machines the world saw were too big and loud. Treatment with their use was not comfortable. The operation of the equipment was based on a motor from a vacuum cleaner, which has been improved. With the help of a package of glue and protection similar to a cyclist's helmet, the mask was fixed on the client's head. Over time, skilled engineer-inventor Jim Bruderer joined Sullivan's team. He managed to improve the devices for CPAP therapy to make masks more comfortable for patients. The masks used to be made individually, as it was difficult to launch their systemic production. The fixtures were still held in place with glue, but in 1984, batch production of products had to be established as the number of patients with sleep apnea increased significantly. Nowadays, CPAP machines are highly compact and lightweight devices. They are complemented by masks that are conveniently fixed on the head with elastic straps. That is why the treatment of sleep apnea with their use has become as comfortable as possible. If earlier their choice was limited to only one model and one manufacturer, now there are really a lot of options. It is important to contact an experienced somnologist in advance who will prescribe the exact device that is suitable for your sleep problems. CPAP therapy is now considered the gold standard treatment for sleep apnea. An improvement in the patient's condition is observed on the very first night of using CPAP therapy. The duration of the night's sleep does not exceed 8 hours. The patient feels rested, full of energy. He is not disturbed by nightmares and forced awakenings associated with the frequent need to drink water and use the lavatory. Moreover, in the process of treatment, improvements in the general condition of a person are noted. Weight is normalized in obese patients, and appetite decreases. In male patients, an erection is restored without the use of medications. With concomitant hypertension, the level of blood pressure decreases. With angina pectoris, the number of attacks decreases. In patients with diabetes, the need for tablets and insulin is reduced. The elimination of snoring and, together with it, the sleep apnea syndrome leads to a decrease in cognitive impairment, an improvement in the medical and social adaptation of patients. The effectiveness of CPAP therapy has been proven in the complex treatment of senile dementia. Patients who use CPAP therapy in the treatment of snoring become more active, capable of developing their creative abilities. Most of them note positive changes in life: normalization of weight, improvement in family relationships, mood, career growth, and gain in material well-being. To be continued in the next episode. Stay tuned.